Good morning. I'm Dr. Roopesh, Department of Orthodontics, DMS Dental College. Today we are going to discuss about the management of class 2 malocclusion. As you may know, class 2 malocclusion, according to the epidemiological data, is the second most common malocclusion in our population. So it's imperative that we have an idea about what class 2 malocclusion is, what is the probable cause of class 2 malocclusion, and how we are going to manage class 2 malocclusion. So today's discussion will be divided into the following topics: classification, the features of class 2 malocclusion, etiology of the malocclusion, and the different ways by which we can manage the types of class 2 malocclusion. According to Angle, the class 2 malocclusion is divided into two types: the div 1, class 2 div 1, and the div 2, that is the class 2 div 2. Further, he has subdivided it into another subdivision where you have class 2 molar on one side and the class 1 molar on other side. This situation can happen in both div 1 and the div 2 malocclusion. We will go to the typical features of the class 2 malocclusion. Here, the distobuccal cusp of the upper first molar usually occludes to the buccal groove of the lower first molar. Also, the distolingual cusp of the maxillary first molar will occlude with the central force of the mandibular first molar. That's the molar relation in class 2 malocclusions. Now coming to div 1, all the div 1s will have the class 2 molar relationship. In addition to that, the maxillary anterior usually will be in labioversion. That is, they will be proclined. Now the features will be, as we said earlier, it has a class 2 molar relationship. There are proclined incisors. The maxillary arch is constricted and we have a V-shaped arch. And usually we have extrusion of the lower incisor. This extrusion usually is so much that you may have a traumatic bite. That is, the lower incisors are going to be impinged on cingulum or even the palatal tissue of the upper arch. Now coming to the class 2 div 2s, again they will have the same class 2 molar relationship. Usually the central incisors are in a normal relationship or maybe even slightly palatally tipped. And usually the lateral incisors are in proclined situation. Now the other features include a wider maxillary arch that's not constricted. You have an accentuated curvous speed that will cause the deep bite, and that deep bite may even be closed bite, that is 100% deep bite. The musculature usually will be normal in a class 2 div 2. The lateral incisors may be in linguoversion, that's tipped inside, and sometimes the canines may be in labioversion. And you have usually supra-eruption of all the mandibular incisors. Now the external features will be actually straight profile, maybe a mild convexity. You have a competent set of upper and lower lips. You have the deep mandibular circus. Your chin will be prominent, and the decreased mandibular plane angle, reduced lower anterior facial height because of the deep bite, and in some cases you may have a hypermentalis activity. Now, if you look at the differences in between the characters of div 1 and the div 2,